Hello, good afternoon. It's Dr. Chudi, founder of Inspirations Global Health Solutions. Thank you and welcome to today's Open Clinic in YouTube. Today is very important for so many reasons, today's topic. So we're going to look at fibroids, and we're going to look at fibroid surgery, which is called myomectomy. When you have gone for myomectomy, how much time do you need to wait before trying to become pregnant? Very important topic for so many reasons. Fibroid is very common among Black women. If we take a sample of 10 women of Black origin, so Black origin means you're from Africa, you're Black American, you're Black Canadian, any Black woman out there has a higher risk factor of developing fibroid within their reproductive age. So I'm going to quickly give us a very simple overview of what fibroid is all about, then what different treatments of fibroid will entail, and my general advice regarding going for pregnancy. So this is the female reproductive system. Fibroid simply is a non-cancerous growth on or in the womb. So remember your female reproductive system. This is the vagina. This is the cervix. This is the womb. So fibroid is a non-cancerous growth. The commonest non-cancerous growth in women, the commonest pelvic growth out there. So fibroid is simply a non-cancerous growth either in or on the womb. There are principally 3 types of fibroid. There are 2 types of fibroid that might have an implication to your fertility, an implication to miscarriage, and also an implication to causing a lot of delays before you become pregnant. 2 of them, intramural fibroid on the lining of the womb and submucosal fibroid. Now, the other type of fibroid is subserosal fibroid on the body of the fibroid. Now, of the 3 types, we are worried about 2 as regards your fertility and becoming pregnant and having good outcome: the intramural and the submucosal fibroid. Now, the major aim and the major determining factor in regards to treatment of fibroid is what? The size and the location and the symptoms. So the size of the fibroid and the location will determine if you will go for myomectomy. Myomectomy simply means the surgical removal of the fibroid. That's simply what myomectomy is all about. But there are different types of treatment of fibroid. We can have expectant management. We won't do anything, especially if the fibroid is smaller than 6 cm, no symptoms, outside the body of the womb. If we have that type of fibroid, we'll just do what we call expectant management. So if you have pain, we give you painkillers. We won't really worry about it. But if you have fibroid in the class of intramural fibroid or submucosal fibroid and is bigger than 6 cm and is causing you a lot of symptoms, pain, heavy bleeding, painful sex, painful defecation, painful urination, a whole lot of symptoms which can happen to you when you have fibroid, then we might begin to think about myomectomy. Myomectomy can be done on 3 different levels. We have 3 different methods of removing the fibroid. If we are going to surgical removal, we can go through the hysteroscopical route. So we go through the vagina and remove whatever we can remove, or we can go laparoscopically. We go through opening some small incision on your belly, then we go in and remove the fibroid. Or we can open your belly up, your abdomen, put through the process of laparotomy. So there are principally 3 different ways of gaining access to the fibroid inside the womb. The method that will be applicable to you will be dependent on your own type of fibroid. No 2 women can have the same type of fibroid. Now, the bigger question is, what is the impact of going for myomectomy? How can myomectomy affect your fertility? How can myomectomy improve your fertility? How can myomectomy improve your chance of becoming pregnant? Thankfully, if a trained specialist, someone that can carefully go into your womb and remove only the fibroid. The problem is, if we remove so many other healthy tissues, your womb can heal with scar tissues, you can be exposed to infection, inflammation, or you can affect the function of other important organs in the womb, or it can have extensive damage to the womb. But if a trained surgeon, a trained gynecological surgeon, goes into your womb, removes only the troublesome fibroid, and you heal properly, and follow what we call fertility-sparing myomectomy. So fertility-sparing myomectomy means we will carefully make sure we avoid damage to the vagina, damage to the cervix, damage to the womb, damage to the tubes, and we only remove the fibroid. If we do fertility-sparing myomectomy, myomectomy can improve fertility and ability to become pregnant in so many women, especially if the type of fibroid you have is submucosal fibroid. So submucosal fibroid and intramural fibroid can directly and indirectly lead to infertility. So when we correct them, we improve your fertility. The bigger question which made us together here today is when? When can you start trying? Which we don't use in our group. We don't believe in trying. When can you start believing to become a mother, to become pregnant? Now, generally, the biggest fear in gaining access to the womb is womb rupture. So the reason why we preach giving your womb a chance to recover before we go in for anything is what? Womb rupture. So the criteria, it's the type, the extent, the depth of the surgical incision on the womb. If you have a relatively careful myomectomy without any damage, without breaching the layer of your womb, when you heal properly, you will heal with lesser scar tissues, lesser adhesions, and you can quickly become pregnant. But there are so many factors that will play a role in regards to when you should start believing to become pregnant again. I don't like using the word trying because trying is more like a passive word. So management of fibroid is an individual thing. Now, globally, we do not have a generalized agreed duration of time you have to wait before you begin to want to have another baby, before you become pregnant. We don't have a generally agreed time frame, whether longer, whether shorter. So different practitioners and different individuals can tailor the need for different clients. So client A, we might want to tell client A, you know what, because of your age, you are both 35, you're probably 45 or 40, but because we cannot wait for 18 months, we want you to quickly try to become pregnant within 4 months. Now, the reason why we want a woman to quickly try to become pregnant, especially after myomectomy, is to make sure there is no recurrence. So you see, unfortunately, in some women, when we remove the bigger and the moderately big fibroid, the smaller ones can grow big over time. So we have some women that after 2 years of having myomectomy, they will start having fibroid again, recurrence of fibroid. It's not the fibroid you removed that went back to regrow, it's the little ones that later became big. So one of the difficulties in giving a general advice regarding when to start is unique characterization of the individual. So what is your own fibroid? How is your own fibroid debated? How is your gynecological issue? What is your age? What is your ovarian reserve? So the key determining factor in telling a woman to wait for standard 18 months, normally, whenever you go to the womb for delivery, vaginal delivery, CS delivery, or any surgery in the womb, we normally advise 18 months to allow your womb to heal. But here's the deal. 18 months is not going to be applicable to all women because some women will need to quickly become pregnant so that they can still use their ovarian reserve. So the key determining factor that will tell us if you can go back in 4 months, in 6 months, in 1 year, or 18 months, it's your age. You have a better chance to wait longer if you are younger than 35. But if you are above 35, we might quickly monitor you, make sure that everything is good. Then you try as soon as possible. So every woman, regarding when to start wanting to become pregnant, will be dependent on your unique quality, your unique characteristic, of which age is the number one thing, because age will determine how much eggs you have remaining. If you are below 35, your ovarian reserve will be more. If you are above 35, your ovarian reserve will drop. Why? Because as you're getting older, the quantity and the quality of your eggs will be reducing. So a woman below 35 will have more eggs, more good eggs, compared to a woman above 35. So if you go for myomectomy, which is the surgical removal of fibroid, and we follow fertility sparing, meaning we are careful, meaning you go to a good doctor, meaning you go to a good surgeon, and he is careful, because the problem is, anytime we're going for surgery, if we are not careful, we can cause further damages. And the body of a woman is very sensitive. We don't want to cause scar tissues. We don't want to cause adhesions. We want to just remove the fibroid, and that's the only thing we're going to deal with. So every single thing regarding when you can quickly begin to want to have another baby is dependent on your own case. So if you've had previous surgeries in the womb, if you've had previous cesarean section in the womb, and you just had myomectomy, you will not be a candidate to start becoming pregnant immediately. Why? Because the integrity of your womb is at risk. So because you can have womb rupture. When you rupture your womb, is an emergency that can kill. So everything is dependent on your own individual case. So if you have significantly big fibroid, the best approach that will give you better chance of becoming pregnant is what? Myomectomy. Now, the type of myomectomy you will go for will be dependent on availability. Lately, we can even go for robotics. So it's not even a normal individual that will manually go in. We use a robot and we remove your fibroid. So the management of your fibroid is dependent on availability of the technology, on what your provider feels. So you can go for laparoscopic route, you can go for hysteroscopic route, or you can go for laparotomy. Whichever one they use, you have to recover. So the common denominator in everything I'm talking about is recovery, healing. We have to see progressive good healing in that surgical site. Healing psychologically, healing emotionally, healing financially before you go again. So it's not something we do in a hurry. It's something we do by the time we factor a lot of things before we say, okay, you know what? After 4 months, go again. After 18 months, go again. So we cannot give the same advice to a woman that is 25 who went for myomectomy and to a woman that is 45. A woman that is 45, we cannot wait for 18 months. Because by the time we come back from 18 months, she will no longer have eggs. But a woman in her 25, you have a lot of opportunity. So we can tell you to go for 18 months. So it's not a straightforward answer. It's something you have to go back to your doctor. You bounce off ideas. Your doctor will evaluate you, check your records, make sure they know the right things to do. Now, why do we recommend myomectomy? You see, some women can have very troublesome fibroid that will affect the quality of your life. There are some women that bleed heavily because of fibroid. You lose a lot of blood and you become anemic. There are some women that have never known peace since they developed their fibroid because every single thing about them is pain. So fibroid can cause a lot of pain. So it's not generally advised to have your fibroid and you want to become pregnant because fibroid grow over time. And in pregnancy, the possibility your fibroid is going to grow is what? High. Why? Because you produce a lot of hormones that will feed the fibroid. Your fibroid also can take a lot of nutrients from your baby and begin to feed itself. So your baby can have a lot of problems. So fibroid can lead to a loss of so many blood that can lead to anemia. But when we go for myomectomy, we are giving you a chance to remove the fibroid and recover yourself and make sure that the only thing in your womb will be your baby. So what we are trying to avoid when we are going for myomectomy is what? To make sure that your baby is gonna develop alone. Your womb should be clean. We don't want any competition. We don't want any stranger. We don't want any intruder. This is why we recommend going for proper management of your fibroid before becoming pregnant. The management of your fibroid is tailored to your needs, tailored to your gynecological needs, tailored to your surgical needs, tailored only to you. So no two women can have the same management of fibroid. One woman, we can quickly tell her, okay, you know what, after 3 months, please, let's get you pregnant. Or just wait for 18 months. So everything is dependent on your own individual package. But please, by all means possible, if you were given a diagnosis of fibroid, please know the type of fibroid you have, know the size, and know the symptom. You should know your symptom. Nobody can tell you your symptoms. But please, we need to know the type. We need to know if it's subserosal. In regards to fertility, the safest type of fibroid to have is what? Subserosal. But if you have submucosal fibroid, 6 cm, giving you hell, you don't have a life, you want to be a mother, you have to remove it. You cannot. Look, there are some women that when we bring out the fibroid in their womb, it's unbelievable. There are some women that when you see them, they will look like they're expecting twins, but they are not pregnant. What they have inside their womb is fibroid. So fibroid is a big burden. Please do not hold fast to your fibroid if you are planning to become pregnant. Deal with your fibroid if it's significantly big, symptomatic, located inside your womb. We want to get that fibroid removed. We don't want you to go through the pain of fibroid during pregnancy, and we begin to give you a lot of painkillers. So the general consensus regarding when to begin to believe another baby is dependent on your own unique individuality. You go back to your doctor will evaluate you and give you your specific tailored management. But we have to keep an eye on the mark. Another important reason why some women will be advised to quickly become pregnant again is the possibility of recurrence. So unfortunately, in some women, we can tell them to come back in 18 months, and by the time they're coming back in 18 months, the smaller fibroid would have regrown, and your ability to become pregnant will be compromised. So everything should be followed to the letter T. Very important. If we can do all this, then we can improve our possibility of becoming pregnant. But overall, if you are believing to be a mother, the best management for fibroid is myomectomy, surgical removal. We don't want to take any chances. In the same vein, for some women, when they are going for myomectomy, we might want to give them some drugs that can shrink the size of the fibroid temporarily. Why do we do this? Because during surgery, if you have extensively big fibroid, you can bleed a lot, you can have anemia, and if you don't have facilities, some women can die. So in some situations, if your fibroid is very big, we give you some hormone-related drugs to shrink the fibroid so that when we go in there, we can quietly and carefully conduct the myomectomy that will not affect your fertility. Very important. Now, if you are considering going for IVF, it's also advisable to make sure that any fibroid that is significantly affecting your fertility, leading to your ability to have good outcome, is dealt with. So it's not advisable to go for myomectomy. It's not advisable to go for IVF when you have significantly fibroid in your womb, because the possibility that you can have miscarriage is very high. Some fibroids can lead to miscarriage. Some fibroids, unfortunately, can damage your womb to the extent you will need hysterectomy, meaning we can remove your whole womb. Very important. Okay, now I'm going to open the clinic, and you can have an opportunity to ask your questions in real time. So now it's time for questions. So please ask your questions right about now. Okay? Time for questions, please. Please ask your questions. Do you have any questions, admin? Kenneth Chinyere, please, you guys should throw your questions in. Thank you, Kenneth. Please ask your questions. We have about 10 minutes. Let's interact, okay? I'm going to post my transcript. Make sure you understand your fibroid. Make sure you understand your management protocol. Please don't delay. I know you're very afraid. I know you're fearful about, oh, your friend told you this and that. I understand that. This is why you need a good doctor, okay? Don't be afraid. Don't allow fear worsen things, because if you have significantly big fibroid, the earlier you deal with them, the better you can become pregnant. But if you don't deal with it, it will begin to be worse. And some fibroids can be deadly. Some fibroids can lead to removal of your womb. I don't want any member in my community having their womb removed. That's the worst thing that will happen to you. Now, if we remove your womb because of bad fibroid, can you still be a mother? Yes. Then will most people accept to go for surrogacy? No. So what's your best chance of becoming pregnant? With your own womb. But don't allow fibroid damage your womb to the extent we have to remove your womb. In some women, that might be the only option. You see, you have to be around. You have to be alive to have a baby. You have to have good quality of life to have a baby. Sometimes, if your life is at stake, we will first of all save you. Like if you have cancer in any of the pelvic areas, we are not going to bother ourselves with getting you pregnant. We are going to bother ourselves with saving your life from cancer, because you have to be around to have a baby. So once you have cancer, our priority is to save your life. The same thing is applicable to a woman. If you have a problem standing in a way that can kill you, we focus on saving you. Because if you are around, you can adopt, you can do whatever to become a mother. But if you die, you won't have that opportunity. Okay, guys, let's see what we have. What happens if one gets pregnant with fibroid? Does the fibroid grow with the baby? Yes. Majority of women that have coexisting fibroid with pregnancy will have bigger fibroid. The reason is very simple. Most fibroids are hormone sensitive. So the same hormone that will be feeding your baby to grow will also be feeding the fibroid to grow. So some women can be carrying one baby, but because of fibroid, they will look like they are carrying twins. And unfortunately, when you have fibroid in pregnancy, it's very painful. Most women that have fibroid during pregnancy will complain about excruciating pain, and we don't feel comfortable giving pregnant women drugs. So when we are giving you painkillers in pregnancy, there are some painkillers that can affect your baby. There are some painkillers that you shouldn't even use in pregnancy. But because pain is not something where we wish even for our so-called enemies, we'll definitely give you some painkillers. But it's not going to be good for you. It's not going to be good for your baby. So to avoid that, we advise you to remove your fibroid before you become pregnant, if they are significant. So, but unfortunately, or fortunately, once you are pregnant and you didn't deal with your fibroid, you're gonna run with that fibroid and your baby until delivery. Now, some women can ask, so what about during cesarean section? Can they remove the fibroid? No. That's not the best practice. In some centers where they have facilities, they can try doing that, but it's not advisable. We deal with each case as they come. So if you have coexisting fibroid with your pregnancy, make sure you are under the care of high-risk pregnancy specialists, because that pregnancy is high risk. So we need to manage you conservatively, manage your pain, manage whatever. Then once you are done having your baby, then we begin the conversation about removing the fibroid. Okay, so the answer is yes. The fibroid tends to be bigger in pregnancy because of hormonal changes, and your fibroid has blood supplies, so you'll be taking the nutrients that your baby and yourself should be using and transferring it to the fibroid. So the answer is yes. Okay? All right. Okay. If a woman's womb is removed due to fibroid, can she still be a mother? 100%. So let me tell you what happens. Now, when we are going for hysterectomy is the process of removing your womb, right? Now, there are different classifications of hysterectomy. We can go for radical hysterectomy. Radical hysterectomy means maybe we were suspecting about cancer, and because all the structures in the female reproductive system are related, we don't want to take chances. So what are we going to do? We can keep some parts of the vagina, but starting from the cervix, we remove everything completely. This is radical hysterectomy. The same thing is applicable when we want to go for lump removal in the breast. When we are doing that, we can also go for radical mastectomy. Mastectomy is the process of removing the breast tissues. So we can go for radical mastectomy. In radical mastectomy, we remove the entire breast. We go to the axilla, your armpit, we remove everything. Why are we doing this? To make sure we give you a chance. Now, if you don't have a need for radical hysterectomy, what are we going to do? We will remove only your womb. We can keep your tubes and we can keep your ovaries. Now, the determining factor that will still make you a mother, even when your womb is gone, is what? Your ovaries. So if we remove your ovaries and we don't do what we call oophorectomy, oophorectomy is the surgical removal of your ovaries. If we don't do oophorectomy and we still kept your ovaries and you still have good eggs, we can now use your eggs and use your partner's sperm and get another woman to become pregnant for you. But you can no longer become pregnant because your womb is gone. So once your womb is gone, you can no longer carry a baby. You can still have your baby, complete. Your baby will be yours 100%. The woman will only be a taxi to have your baby. When it's your own eggs and your partner's sperm, that baby that a surrogate woman will have, it's your baby, 100% genetic component of you and your partner. The woman just acted as a vehicle. This is what happens. So my point is this. Please, if you have significantly symptomatic fibroid that needs to be removed, remove it. Because some women might end up getting recommendation to remove their womb. Some women will quickly want to become pregnant and have a baby, even with big fibroid. That's not advised. Some women will not deal with their fibroid until it's very late. Baby, you don't have. Fibroid you didn't remove. You are having perpetual pain as a woman. Now, thankfully, in some women, as you're getting older, the fibroid begins to shrink. The hormone fluctuation in women. So it's expected that as you're getting older, the level of your estrogen is coming down because estrogen somehow feeds the fibroid. When the estrogen level is coming down, the fibroid will be shrinking. Default, naturally. But it doesn't happen like this all the time. But it's expected that a woman that has fibroid, when she goes into menopause or as she's getting older, the size of that fibroid will be shrinking. Okay? I hope I made myself clear. All right. Can a woman with gravid uterus still conceive? So let me explain this because you didn't understand the meaning of gravid. Gravid means you are pregnant. So gravid womb means a womb that has a baby. So if you see gravid in your report, it means you are pregnant. So you got it all mixed up. So your question is not applicable to this particular need because you ask, can a woman with gravid womb still conceive? If you have a baby growing inside your womb, you're already pregnant. Now, in some situations, I don't know if it's what you're asking. In some situations, you can have a baby, you've already conceived, right? And for some reason, your body will release another egg. You make love either to your partner or another guy, then you become pregnant again. That can happen. Okay? But when you see gravid uterus means pregnant womb. There is a baby developing in your womb already. Okay? All right. Can fibroid be removed during childbirth? Like I mentioned, Chinyere, in some centers, like one of our guest presenters, I don't know if you attended that particular event, when she was discussing fibroid and clomid, she told us that when she was pregnant for her baby and she had significantly big fibroid, when they were doing the cesarean section, they removed the fibroid. So in some centers where they have facilities, where they have expertise, they might try to remove the baby and the fibroid during CS, but it's not generally recommended globally. Okay? All right. What causes fibroid? As of today, we don't know. So it's still unknown, but we know some risk factors. Lifestyle, ability to eat clean, ability to exercise, you avoid your alcohol, you avoid your smoking, you don't add a lot of body weight, and you mind what you eat more plant-based protein regarding or as against animal-based protein. But we don't know the exact thing that causes fibroid. It's unknown. In medical practice, there are so many things we don't know, so we call them unknown. Fibroid is one of them. But we know that as a Black woman, the possibility you develop fibroid is very high. Okay? All right. Correct. Any like correct, lifestyle modification, clean lifestyle, drink a lot of water, avoid your alcohol, exercise, sleep, avoid stress, don't add a lot of body weight. These are lifestyle modification that can help improve your possibility of avoiding fibroid. But if you're gonna have fibroid, you're gonna have fibroid. If your mom have fibroid and your sister have fibroid, possibility you have fibroid in your womb is very high. Okay? You had your myomectomy around September, and 3 months after, you had your menses without stress. But 3 months after the menses ceased, what could be the cause? Now, this is what happens. Anytime you have surgery or you have any procedure in your body is confused. So your body is trying to come back to normal. So if your period returned 3 months after your myomectomy, then 3 months afterwards it ceased, I want to know your age. I want to look at a couple of other things. So the question is, what have you done about it? Have you gone to your gynecologist? Have you gone to a fertility specialist? How old are you? Your age is very important. So what might be happening might be independent of the myomectomy you had. Okay, all right, let's see. Can fibroid be treated by prescribing Zoladex? Okay, so here's the deal. Zoladex is a drug that when we give you, it suspends every single thing that happens in your body hormonal-wise. So Zoladex is not a permanent treatment of fibroid. It's just a temporal measure to, keep your womb in a steady state so we can monitor and do whatever we can do. So Zoladex might be a temporal quick fix for a significantly big fibroid before we eventually go in there and do surgery. It's not a permanent treatment. Okay? Is fibroid hereditary? Yes. If your mom had fibroid, if your sisters had fibroid, the possibility you also develop fibroid is high. So the answer is yes. Okay? Surrogate mother, correct. So I'm just trying to use an analogy, okay? So you understand it better. So in surrogate mother, for some reasons, some inexplicable reasons or some explicable reasons, your womb cannot carry your baby, but you still have your eggs, or you don't have an egg and you're ready to go and use donor eggs, but you still want to be a mother. In that situation, we get another woman who will check and make sure she's okay. That woman will now be the person that will become pregnant for you because your womb cannot carry a baby. So what are we going to do? We make sure you're producing enough eggs. We collect your eggs, collect your partner's sperm, make sure they form an embryo. Then instead of transferring it to your womb, because your womb cannot deliver the baby, we transfer it to the other woman. And after 9 months, the other woman will have their baby and the baby will be yours. This is what happens in surrogacy. Okay? All right. Can you take letrozole to improve your egg quality? So this is what you need to do. Whatever your fertility doctor gave you, take it. Letrozole, Clomid, they are all fertility drugs. So follow the instructions of your doctor, but don't take it by yourself. What we don't subscribe in our community is self-medication. Don't take Clomid by yourself. Don't take letrozole. Don't take any fertility drug. If your doctor didn't prescribe it, don't take it. But if your doctor prescribed it, please go ahead and take it. Can a woman with a frozen pelvis conceive? Frozen pelvis by itself is already a medical problem. Frozen pelvis means for some reason, it's called contracted pelvis. So many things are going on, so many pathologies. So all the pelvic structures in your body are not working the way they should. So the answer I will give you, my sister, if you were given a diagnosis of frozen pelvis, your best option is to go for surrogacy. Okay, guys, my time is up. If we don't have any other question, then I'm going to take my leave. Make sure you share this video. If today is the first day of attending my clinic in YouTube, I normally show up every Saturday about this time, then every Tuesday. Make sure you subscribe to our channel. Check out other videos. So many videos of great importance. Now, if you're in Facebook, you don't want to miss this community. Snowspirations, Global Health Solutions. We have so many platforms. You can go to our page. You can go to our group. We also have a newer community. So we have our SGHS community page. So there is no way you can miss us out there in Facebook. Now, if you're in TikTok, we are in TikTok doing due diligence to everything health. If you're in Instagram, we are there. If you're in Twitter, we are there. So all the social media are covered. So whichever one you prefer, always be on the lookout for SGHS. Okay? So thank you for coming this afternoon. I want to believe you're going to have an amazing time this weekend. I have another question. What's the best time to start practicing after ectopic pregnancy? Now, this is the deal. Ectopic pregnancy is an emergency, right? So in ectopic pregnancy, most times we remove that part of the tube that is damaged, right? Now, when we remove one of your tube, you are now compromised. You can still become pregnant because you still have one tube remaining. So what I will tell you is this. Any woman, unfortunately, that have gone through salpingectomy after ectopic pregnancy. So ectopic pregnancy means the baby is not developing in the womb, the baby is developing in the tubes or elsewhere. So anytime your baby is not developing in your womb, that condition is called ectopic pregnancy. So what I will advise you is very simple. You have been compromised. You now have 50% chance of becoming pregnant with one tube. You can still become pregnant. So you have to have a special doctor attached to you. You are no longer going to see a general practitioner. You're going to see a high-risk pregnancy specialist so that we can be sure we do everything within our reach so that you will not have a repeat ectopic pregnancy. Unfortunately, women that have ectopic pregnancy have a higher chance of having a repeat ectopic pregnancy. And if you've had ectopic pregnancy in one tube and you have it in the other tube, you've lost the function of the two tubes. And when you lose your two tubes, can you still be a mother? Yes. But how? You go for another IVF option. So any woman that has had her womb, so her tubes damaged can still be a mother, but you cannot become a mother naturally. You have to use assisted reproductive technique. So please go back to your doctor and make sure you follow the instructions. The problem is we are in a hurry. We want to figure things out by ourselves, but there are doctors that are trained in different disciplines to help you based on your problem. Learn how to use those doctors, okay? All right, thank you so much. My time is up. I'll see you guys again on Tuesday. Okay, until I see you, thank you for coming, and thank my admin for coming. God bless you and enjoy your weekend. Bye-bye for now.